Hey everyone, my name is Sienna Boyd and we are back in the Choose Health studio at Rancho Family Medical Group. We are actually joined with Dr. Susan Behnawa, who is a board certified geriatrician, and she practices out of Sun City. So today we're going to be discussing preventative medicine. I know that's a huge topic, especially as a geriatrician. So can you tell us a little bit about some of the things like the screenings that you've heard of? You know, we talk about mammograms, colonoscopies, but what are some other things that we should be screening for?
I think one of the biggest things that tends to be a little bit overlooked because it's not as mainstream or really advertised or out in kind of general knowledge is a lot of people are really good about getting their breast cancer screening, their colon cancer screening, and I think that the one of the things that falls by the wayside is bone density screening.
Interesting.
And so when you talk about bone density screening, this is the DEXA scan, and it's such an overlooked part of health that we really are trying to bring more awareness to it.
Okay, so what is bone density screening? So when you say that, what kind of bone density issues is someone having as they progress in age?
So as you collect more birthdays, so your bones are constantly being broken down and built back up. So you have the builders and then you have the breakdown component.
Okay.
So you have your osteoblasts that are building up your bone, and then you have your osteoclasts that are breaking it down. And over time there can be an imbalance where you aren't keeping up to rebuilding the bone that you've lost. And so the biggest players, especially as we get older, is just not being as active, not as much weight-bearing exercise. And so the bones actually need some stress and some force on them to continue to remodel and stay strong. And so when we talk about, you know, one of the most important things you can do for your health as you get older is lifting weights, weight-bearing exercise. So a lot of people are really good about doing their walks and swimming and, you know, their Zumba or, you know, all of these things. But it's also really important to not neglect the weight-bearing exercises. So lifting weights, putting that force on your bones really helps it regenerate and stay strong. And so why do we care about the bones staying strong?
That's a great question. That's what I was going to ask.
So the biggest thing is we're trying to reduce the risk of a fragility fracture. So what's a fragility fracture? A fragility fracture is a break in the bone, whether it's you know, in a vertebra in the back, if it's the hip or a bone in the wrist, that's sustained as the result of a low velocity trauma. So not a high velocity trauma like you're in a car accident, but a low velocity trauma like you trip and fall and you try to catch yourself by, you know, falling on an outstretched hand, and then you end up with a risk fracture. Or you know, you're getting up to go to the bathroom in the middle of the night, you trip on something on the floor and you fall and you happen to break your hip. So these fractures are very debilitating and they're devastating injuries to have because there's a lot of recovery that comes. Hip fractures in general, if you look at the mortality several years out, there's, you know, it's over a 30% mortality because people can get so many complications from being in the hospital with a hip fracture. And so one of the really straightforward things that we like to do as a screening study is we like to send you for a bone density scan. So what a bone density scan is it's kind of a more sophisticated x-ray. We're looking at the density of the bones in the lower spine and in the hip. And what we're looking for is where you fall compared to what would be an average or a zero. And so we kind of hold you to this middle marker. If your bone is less dense than the standard, then you get a negative value for your bone density. So we're talking about the T-score here. And so if your T-score is, you know, less than that zero, but it's greater than minus 2.5, you're in this osteopenia range, which is pre-osteoporosis. If you're less than 2.5, then you fall into the osteoporosis range. And here is where your risk of a fragility fracture is really high. If you're in this osteopenic range, which is this pre-osteoporosis, then what we do is we calculate your FRAX score, which is your overall risk of fracture given all of your other health markers. And so if you're osteopenic with a high FRAX score, or if you've ever fractured at any point in time, then we treat you as essentially being osteoporotic. And so what that means is we would want to use medicines to help strengthen your bones to lower the risk of having a fracture down the line.
Now, are there specific medications you would prescribe? Are there supplements? Or, tell us about what one would take.
So anybody who is above the age of 65, especially women who are postmenopausal.
Okay.
The most important thing to understand about bone health is that your body needs the basic building blocks to be able to restructure and reframe the bone. So what are these building blocks? We're talking about calcium, vitamin D, and magnesium. So these are the three main players. So for calcium, what we're hoping for is a total dose of about 1,200 milligrams. That's combined between your diet and your supplementation.
Oh, wow.
So if you're somebody who does a good job with your dairy, you're eating full-fat cheese, whole milk, or whatever that looks like, then you take what you're eating from your diet and then you supplement to reach the 1,200. If you're someone who can't really tolerate dairy in any capacity, then you would need a higher supplementation dose. And so calcium is always good. A lot of calcium comes formulated with vitamin D because they're so interdependent on each other.
Wow, okay. I've seen that, like on milk it says vitamin D included.
Fortified with vitamin D because it really helps with the overall metabolism and the overall bone health.
Right.
For vitamin D, interestingly enough, even though we're in California, a large majority of our population is vitamin D deficient, despite the massive amounts of sun exposure that we have.
That surprises me.
And a lot of it is, we do take measures for sun protection. A lot of our patients have had scares with cancers or precancers of the skin. It's general good health to wear sunscreen when you're going out, longer clothing, hats. And so vitamin D supplementation is probably your best bet.
Okay. Where else would one get vitamin D aside from the sun? Does it come in foods?
A lot of foods are fortified with vitamin D. You can find orange juice that's fortified. You had alluded to previously milk is fortified. But a lot of the times vitamin D specifically, you just do better with vitamin D supplementation. Most of our patients who are vitamin D deficient typically need about 2,000 international units a day. If your vitamin D is profoundly low, and this is a blood test we can order for you in the clinic and kind of see what dose is correct for you. If you're profoundly low, you may need 5,000 international units per day. So a good general dose just for supplementation for overall bone health is usually about 2,000 international units per day with the calcium. It's also really important to understand that calcium and magnesium are also really important together. Magnesium is vital for both bone and muscle health, and a lot of people are magnesium deficient, but they don't really realize it because it's not really one of those hype things to check and to kind of look into. And so it's really important to understand with magnesium that there's different forms of magnesium and it does different things in the body.
Interesting.
And so magnesium citrate we use a lot for constipation. It does cause diarrhea. And so when you're using magnesium citrate, that's not a magnesium form that you want to be using to supplement a magnesium deficiency. That's a form of magnesium that you're using to treat constipation. So you have to be careful because it's available over the counter.
Choose your magnesium wisely.
Watch the magnesium. Far and away for magnesium deficiency, forms for supplementation that can be really well absorbed by the body and really easily accessed is magnesium glycinate or chelated magnesium. But they're a little bit more difficult to find. And so a lot of people will either go to a health store or just look specifically for those forms, or you can order them off of the internet. If you're using magnesium for migraine headache prophylaxis or trying to decrease the frequency of migraine headaches, usually magnesium oxide is a good bet, around 400 milligrams daily. I had a physical medicine and rehabilitation physician at the VA who would put all of his patients on magnesium. And so the question is always, well, what's the dose? And so he would say the dose of magnesium is you start slowly, you keep taking it until you get diarrhea, then you back off a little bit. And that's the dose of the magnesium. So everyone's going to be a little bit different in terms of how much magnesium they can tolerate. You're not looking for diarrhea, but you're looking for, stools that are easy to pass. But the magnesium itself, if you can't tolerate it orally, you can also do, Epsom salt soaks and get your magnesium transdermally. And so a lot of people like to do that instead. They'll just take a bath in Epsom salts, and then some of that magnesium is absorbed, and then it helps them with that.
Now, is magnesium something that you can eat enough of in your nutrition, or how would somebody get magnesium?
It's really hard to get, dietary magnesium, and I think especially with transdermal or through the skin supplementation with the Epsom salt baths, even if you can't tolerate it orally, you have a good way to do it. I love using magnesium for sleep. It's very calming. It has very relaxing properties, and so there are a lot of calming teas that contain magnesium as well, which can be really helpful.
Okay, so what I'm hearing is you need magnesium, vitamin D, and calcium. And those three together make this beautiful concoction to aid in maybe hopefully preventing some osteoporosis.
Those are, I think, kind of stage one when
Okay.
you're talking about bone health.
Okay.
And then if you truly have osteoporosis or osteopenia, or you're fractured in the past, or you have a high frac score, then you have to level up to the prescription medications.
Okay.
And so when we're talking about the prescription medications, there are general classes of them that we use, and some may be right for you and some may be not the best fit. And so, you know,
Okay.
class-wise, we use bisphosphonates, which is basically a class of medication that helps slow down the breakdown process so your body can catch up. There's antibodies that we use, like, you know, that are infusions or injectables.
Okay.
And then there's parathyroid hormone analogs. So it's a lot of shop talk for saying different
Yeah.
types of medicines that are right for different types of patients.
Okay.
And so talk to your doctor about which one's appropriate for you given all your other medical conditions. But if you're in that osteopenic range, or if you've ever had a fracture at any point in time that was a low velocity trauma, you're somebody who should really be thinking about what can I do down the line to prevent fractures in the
Okay.
future. So we have, you know, the supplements, prescription medications, and then also really, really important is working on your balance and your core strength.
Okay, and how would you suggest some of your older patients work on their balance or core
Mm-hmm.
strength?
So I think that straight out of the gate, the best thing to do is some sort of physical activity, whatever
Okay.
that looks like for you. At Rancho Family, as part of our senior center, when we have classes, we have balance classes, which is great. You know, we have yoga classes, which also work on stabilizing your core and really help with balance when you're holding those certain positions. The other thing that is really important is individualized physical therapy, individualized balance assessments. And so I have a lot of patients who, let's say they've had a fall or something has happened, or they're just not as steady on their feet. The value of a good physical therapist who can do a balance and gait assessment and give you strategies on how to transfer, how to get up, how to move, how to walk. It's such a great thing to do, and a lot of our patients don't realize that that's something that's available through them, just as a physical therapy referral through their doctor. And so that's really important. I think overall, a lot of patients kind of fall into the trap of, I'm having balance problems, let me get a cane or a walker. There's actually a lot of thought and evaluation that goes into picking the correct ambulatory assist device.
Wow, that is so interesting. I know I would never think that. I would be one of those people who would say, oh, I'm not walking that well. Maybe I should just grab something to assist me rather than, hey, maybe there's something I can do to help prevent it getting worse. Maybe there's something even better for me that'll help me walk even better. So that's where you want to consult your physician.
Absolutely. So generally speaking, certain types of canes are better for pain than for balance. Certain types of walkers are better for certain types of imbalances. So everybody kind of likes the rollator walker. It's the 4-wheel walker with the seat. It's super fancy. You can put things in it. But you have to have really good balance and core strength to be able to use that safely. A lot of the times the rollator walkers tend to slip away from people, especially if they don't have a good center of balance, and it actually can predispose to injury. And so part of the functional assessment that you can do with a good physical therapist is they can have you try different types of assist devices and see which one is safest for you. Before, versus kind of just, oh, my neighbor had an extra one of these and she gave it to me, or my son noticed that I was walking more slowly so he picked up a cane for me. So we use different things to overcome different boundaries to ambulation, and I think it's really important to have somebody who can really watch the way that you walk and make the recommendations on that basis.
That I would never have known that was something that you could do or even be referred to from your primary care. So that's pretty awesome. Well, thank you so much just for joining us and educating us even more about preventative health. I think that's something that we all need to know as we get older, and especially if we have older parents or older grandparents.
And it's so important to keep up with your preventative health.
Definitely.
Balance and bone density screening is just one of the facets of, you know, your overall health. And so it's one thing that, you know, make sure you schedule your annual physical, make sure you're doing your routine visits. We can't do everything in one time, but we can slowly build over time to a picture of optimal health.
Definitely. Thank you so much, Dr. Behnawa, for being with us today.
It's my pleasure. Thanks for having me.
Always.